This medication is used to relieve mild to moderate pain, such as headaches, menstrual periods, toothaches, backaches, osteoarthritis, or cold/flu aches and pains. It is also used to reduce fever. The dosage for children is based on their weight and age, and it is usually given every 4 to 6 hours as needed. It's important to follow the dosing instructions on the label and not exceed the recommended daily dosage. It's best to take this medication with food or milk to help prevent stomach upset. Always consult with a healthcare professional before giving this medication to a child, especially if they have any underlying health conditions or are taking other medications. When giving acetaminophen to children, make sure to use a product specifically meant for them. Use your child's weight to find the right dose on the product package. If you don't know your child's weight, you can use their age. For liquid medication, shake it well before each dose. Follow all directions on the product package and use the provided dose measuring spoon/dropper/syringe to ensure the correct dose. Do not use a household spoon. For rapidly dissolving tablets, chew or allow to dissolve on the tongue, then swallow with or without water. For chewable tablets, chew thoroughly before swallowing. Do not crush or chew extended-release tablets. Swallow them whole to avoid the risk of side effects. For effervescent tablets, dissolve the dose in the recommended amount of water, then drink. Pain medications work best if used at the first signs of pain. Don't wait for the symptoms to get worse, as the medication may not work as well. Do not give this medication to your child for fever for more than 3 days unless directed by your doctor. And for pain, do not give it for more than 5 days unless directed by your doctor. If your child has a sore throat along with high fever, headache, or nausea/vomiting, consult the doctor promptly. If the condition lasts or gets worse, or if new symptoms develop, tell your doctor. And if you think you may have a serious medical problem, seek medical help right away. If your child's doctor has prescribed this medication, it's because they believe the benefits outweigh any potential risks. Most children who use this medication do not experience any serious side effects. However, if you notice any unusual effects, it's important to contact your doctor or pharmacist right away. While it's rare, a very serious allergic reaction to this medication can occur. Seek medical help immediately if you notice symptoms such as rash, itching or swelling, severe dizziness, or trouble breathing. Remember, this is not a complete list of possible side effects, so if you notice anything else that concerns you, be sure to reach out to your healthcare provider. And as always, if you have any questions or concerns, don't hesitate to speak with your doctor or pharmacist. When it comes to children's pain and fever, it's important to be cautious with acetaminophen. Taking too much of it can cause serious liver disease, and adults should not exceed 4,000 milligrams, 4 grams, in a day. If you have liver problems or if you're giving it to children, you should take even less. Make sure to ask your doctor or pharmacist for guidance on the safe amount to take. Also, be careful not to use any other medication containing acetaminophen without consulting your doctor or pharmacist first. Acetaminophen can be found in many non-prescription and prescription medicines, such as pain or fever drugs, as well as cough and cold products. Always check the labels on all your medications to see if they contain acetaminophen, and ask your pharmacist if you're unsure. If you accidentally take too much acetaminophen, seek medical help immediately, even if you feel okay. An overdose can lead to symptoms like nausea, vomiting, loss of appetite, sweating, stomach pain, extreme tiredness, yellowing of the eyes and skin, and dark urine. It's also important to note that daily alcohol use, especially when combined with acetaminophen, can harm your liver. So, it's best to avoid alcohol altogether. Before giving acetaminophen to your child, it's important to talk to your doctor or pharmacist if your child has any allergies, as this product may contain inactive ingredients that could cause allergic reactions. You should also inform your doctor or pharmacist about your child's medical history, especially if they have liver disease or if they regularly use or abuse alcohol. If you're considering using liquid products, chewable tablets, or dissolving/effervescent tablets and powders, be aware that they may contain sugar or aspartame. If your child has diabetes, phenylketonuria, PKU, or any other condition that requires them to limit or avoid these substances in their diet, it's important to ask your doctor or pharmacist about using these products safely. If your child is pregnant or breastfeeding, consult their doctor before giving them acetaminophen. Now let's talk about the possible interactions of children's pain fever with other medications. It's important to keep a list of all the products your child uses and share it with your doctor and pharmacist. This includes prescription/non-prescription drugs and herbal products. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with this drug are ketoconazole and levoketoconazole. Also, this medication may interfere with certain lab tests, possibly causing false test results. Make sure lab personnel and all your doctors know your child is using this drug. If a child has taken too much of this medication and shows severe symptoms such as passing out or difficulty breathing, it is important to call 911 immediately. Otherwise, contact a poison control center right away. In the U.S., you can call your local poison control center at 1-800-222-1222. Canadian residents can call a provincial poison control center. Symptoms of an overdose can include nausea, vomiting, loss of appetite, sweating, stomach/abdominal pain, extreme tiredness, yellowing of the eyes or skin, and dark urine. Acetaminophen is a medication that can help reduce pain and fever in children. It does not cause stomach or intestinal ulcers like other pain medications, but it also does not reduce swelling. It's important to consult with your doctor to determine if acetaminophen is the right medication for your child. The recommended dosage for children is based on their weight, and it's important to follow the dosing instructions carefully. Acetaminophen can be given every 4 to 6 hours as needed, but it's important not to exceed the recommended daily dose. Always check with your child's doctor before giving them any medication. If your child is taking this medication regularly and misses a dose, they should take it as soon as they remember. However, if it's almost time for the next dose, they should skip the missed dose and take the next one at the regular time. It's important not to double the dose to make up for the missed one. Remember to store this medication at room temperature, away from light and moisture. It's best to keep it out of the bathroom and away from children and pets. Also, make sure not to flush this medication down the toilet or pour it into a drain unless instructed to do so. When it's expired or no longer needed, be sure to properly discard it. You can consult your pharmacist or local waste disposal company for more information on how to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.